Oh, I do community interventions sometimes. We're, in the workplace. I really am responsive to community needs and people who want to make a change to improve health. And so other times I work a lot in schools. So, I have a project in parks right now where we're trying to improve the parks. And so it really depends on the community needs and what it is that we can do to help with a little research to answer a question that they have or provide some data that they need in order to move a project along that they think is important in the community. But it really it's their design of the whatever they think would help improve the health of their community that we're there to assist with. Yeah, what we do is when we're working with the communities, we're trying to answer a question that they have. And when they put a policy into place or they make a change in the environment, then we try to assist and find some funding to go back and look at what happened as a result, because we all need evaluation results. That's really important. So in the beginning, we're trying to collect information that will help inform the development of whatever program or policy they're working on. And in the end, we're trying to evaluate it to see if it actually is doing what it's intended to do. Because in the case of our work with childcare, where we were able to work with the legislature to put in place some regulations on the kinds of sweetened beverages that are offered to children in childcare and reduction of sweetened beverages in childcare. We went back and measured what kind of beverages were being consumed in childcare, and we learned that it worked in some instances, and in other instances, the childcare providers didn't know about the new regulation, and so they weren't doing anything. So in that case, we went and talked to those who in the Department of Education about providing some education or training for new childcare workers so that when they start the job, they'll know about that regulation. So we were able to then get that on the books as well, that there's more nutrition training now for childcare workers in California. So that's the kind of work that we do. We try to always be looking at the effects and to see what else needs to be done to really make it an effective program or policy. Well, we're finding that taxes on sugar beverages are actually reducing consumption of sugary beverages. So if that's the goal, and that is associated with better health, then we're very happy that that's the effect. I know, I know people say, how can you be for a regressive tax where the poor pay more because they drink more beverage and they're paying more tax? And I say, well, diabetes is regressive too. The poor have more diabetes. And so, so it's a solution that is really able to reach in and help people to make a decision not to purchase that, and they're buying alternatives, and drinking water consumption is way up. So that's very good for their health.